Most of my focus today is going to be on things you can do in your OHTs to self-serve getting some of these forms of evidence. But I do also point to the fact that, evidence support of the types that Justin, Diana, and John mentioned that Walter provides, among others in the province, are absolutely essential. But I hope that the big picture that I'm providing about different sources of evidence and some of the steps and prompts that you can take internally will help you and your group and your OHT kind of advance your work using best evidence as needed. And then reaching out to groups like RISE or like OHRI or Craner or HSPN when you can't find what you need to get, and you do need to engage folks who can provide you with, as Walter described it, the intro, new flows of evidence. So I think this is pretty clear to everyone. Justin really helpfully at the end of his presentation mentioned how evidence synthesis and support really is a separate gear that we need to be focusing on, but transects all of the others. And importantly, we need to be considering the use of evidence and improvement cycles more generally, whether we're focused on the Big Bang reform decisions, such as introduction of OHTs, but all of the 1,001 organizational program decisions that you and your groups need to be making. So evidence synthesis and support, I'll take a deep dive here. And again, as I mentioned, I'm going to really be hopefully focusing on some of what I would call self-serve stuff. But why is this gear important more generally in the context of the work that we're doing? I think Justin mentioned this and others alluded to it. It's just really helpful to be able to pull on existing evidence and rapid evidence syntheses from groups that are able to provide those to help you get a sense of what has worked, what hasn't elsewhere, what are the key components of those things that worked, when can they be adapted, or where do they have to absolutely stay in place, what conditions are key, what context matters most, and what barriers are identified when you're thinking through either a program that you're thinking of implementing, a particular clinical pathway, et cetera. So all of these things can be informed by existing evidence. So what are the benefits of things like evidence synthesis? I'm going to get into many different forms of evidence today in a second, but evidence synthesis specifically versus a single study. So I know that for those who have taken methods courses, you'll know this already, but I think it's worth reminding ourselves that an evidence synthesis ideally is a summary of what's been learned about a particular question you have from all of the studies conducted around the world on that particular question, including, when they're really well done, how this might vary by groups and contexts. And this is very different than what can be learned from a single study conducted with a single population in a single health system or region or a community. Those can be helpful as well to help you contextualize global findings, but there are some benefits to those kind of big picture global evidence syntheses. So they're likely to lead you in the right direction. So frame negatively, less likely to be misled by the results of a single study. If you're relying on evidence syntheses, it can increase your confidence that something is going to work, particularly when you have an evidence synthesis, say, includes 100 different studies, all showing the same findings. If you know that things have worked the same and the results have been the same across 100 studies over time and in many different settings for many different groups, your confidence can increase dramatically at the ability of that particular intervention, program, clinical program. Anything you're thinking of will work across different contexts. I'm not going to get into too much of the technical stuff today, but essentially, if you're looking at questions of effectiveness, so does something work? Does a program work? Does this clinical pathway or this approach to implementing a clinical pathway work? You can get more precise estimates of whether something works with a well-conducted evidence synthesis, particularly when there are many studies included. Really importantly, I don't think anyone else mentioned this, but given we know that context, issues and evidence evolve over time, increasingly we're seeing folks like Justin's group, others doing what we're calling living evidence synthesis. So regularly updating an evidence synthesis, making it publicly available. Often these are powered by artificial intelligence and machine learning. And this can help you stay abreast of any new evidence that comes out. So during COVID, this was absolutely essential as the evidence base was shifting sometimes hourly. So really important thing to note there. So what do we mean by evidence synthesis and support? So I've already already mentioned it a little bit, but when we talk about evidence synthesis, it's really two things, and I think Walter said this really succinctly. You can either pull on existing evidence syntheses that exist, or engage groups like Justin's, Diana and John's, Walter's, mine, to do new rapid evidence syntheses on questions you might be looking for. So you can be pulling on the global evidence base or asking for a contextualized evidence synthesis. All of these approaches really, though, are pulling on all the best studies in the world on a particular question you might have. I've already mentioned it's a key input into Gear 3. Really, when you're co-designing, Justin mentioned this as well, but it's really important among all the other gears as well. And I'll get into that in a second, as I will show on the next slide as well. Other forms of evidence, we've heard about many of them today, are really important at different points in the learning and improvement cycle, and we'll talk about that in a second. But again, the focus for the next little bit is going to be on prompts that I hope will make your life easier when you're thinking through, how do I actually reach into the research world, pull out the best evidence syntheses in ways that are simple and hopefully not creating too much of a burden on my team. So you can see here, I'll start with the fact that evidence syntheses can be done of any of the types of evidence or research that I've listed here on the screen. But just to note that there are many different types of evidence that can inform your decision making as part of learning and improvement. So you might just be at the beginning stage, which was discussed during the last webinar, of what are the system gaps and what's driving them? What are the inequities that my OHT is facing? What priorities are addressing? So here's where you would look to things like data analytics, modeling, and qualitative insights to try and get insights about how to approach Gear 1. Of course, as I've already said a couple of times, you can also get evidence syntheses of all of these types of studies as well. In Gear 3, when you're doing co-design, of course, you'd be drawing on evaluations of similar interventions that you're considering or programs that you're considering to see if it's worked and how it's worked. Modeling studies can help you predict what might happen when you pull a particular lever, introduce a program. Qualitative insights can also help you understand how different stakeholder groups might perceive an approach you're thinking about. And of course, you can also have evidence syntheses of all of these types of studies as well from around the globe. You might also be looking here to health technology assessments, cost effectiveness analyses, and guidelines to provide you with direct recommendations about what you ought to do to address a particular problem. When you're implementing, evaluating, taking feedback and adapting in real time, which would be Gear 4 and 5, you'd be drawing on many different types of evidence as well. So behavioral and implementation research with groups like Justin, qualitative insights that many of the folks on the call today spoke about, of course, evidence syntheses of all these above. And as Walter mentioned earlier, this process in and of itself should be considered an opportunity to create new flows of evidence. So you'd be doing data analytics in real time, evaluating your approaches as you're implementing them in your OHT, and contributing to the knowledge base that other groups in your OHT or other OHTs across the province can be leveraging to advance their own priorities. So here's the quick and I hope clean enough prompt list that I think will help you and your teams be systematic and transparent in a relatively easy way when you're looking to draw on existing evidence syntheses in your work. So as I've already mentioned, it can be important in many different stages of the learning and improvement cycle. And here are the 5 prompts, which I'll get into each in turn. It's important to keep in mind that the evidence support kind of infrastructure in the province has moved very, very rapidly and changed a lot since, I would say, the last 3 years. So learning from COVID and trying to put in place those things that can help folks leverage evidence when it's needed. And ideally, these can help you do your work more efficiently. So the fact that we do have groups like Diana and John's at Craner, Justin at OHRI and HSPN, is just a real boon to our ability to leverage best evidence in our work and have greater confidence in how we're moving forward. And also something I think it's important to note that it is easy for people outside your organization to assess documents that it puts in the public domain. So consider whether or not you're using some of these prompts and taking these into consideration when your group is publishing something. Trying to be systematic and transparent will give others the confidence that they can draw on your insights from your OHT and implement it in their own setting. So the first prompt, really confirm that it is research evidence that you actually need. So you don't always need research evidence to do everything, but certainly there are times where you do. So just a little bit of a level set, and apologies to those who, this is something that, you yawn at, but not everyone knows this. So I think that it's important to understand that research evidence has three important attributes at least. There's probably many more. I don't want to get too technical today, but usually when we talk about research evidence, it's an output of empirical research that was conducted systematically, reported transparently, and it doesn't matter if it was peer-reviewed or where it was published or posted. It needs to be conducted systematically, transparently. It can take one of many forms. So there's at least 5 forms of domestic evidence, 1 form of global evidence, and 2 forms of recommendations. I've already listed these in a previous slide. So domestic evidence includes things like local data analytics studies, modeling and evaluations. Global, of course, would be those evidence syntheses I've spoken about, and recommendations include things like health technology assessments, cost effectiveness analyses, and guidance. Really important is number 3. So you need to be able to assess the quality of research evidence using explicit criteria, or the credibility or risk of bias. And this really just depends on which evidence paradigm is being used. So there are many ways to take into account the quality of a piece of research evidence. And this is one of the kind of 3 attributes that I think are important. Now, considering other types of helpful complements to research evidence. So things like stakeholder positions and public sentiment. So there are methods that are used to get those, but we wouldn't necessarily consider those research evidence. Internal policy documents and what other jurisdictions are doing aren't necessarily always research evidence, in our opinion. Lived experiences sometimes can be reflected in well-conducted, systematically and reported transparently designs, but not always. So these wouldn't necessarily be considered research evidence. And there's many others listed there just as a bit of a level set. When we talk about research evidence, the 3 attributes are what we're talking about. So if you have determined that research is what you need, then I think it's helpful to use a framework to orient yourself to going into the research evidence and identifying what you need, because as I've already mentioned, depending on where you are at in the learning improvement cycle, it could be a different form or a different type. So there's policy analyses frameworks, there's program analysis frameworks that can ask similar but slightly differently framed questions. There's systems analysis frameworks to trying to understand things like, do we shift governance, financial and delivery arrangements, or put in place different implementation strategies to make sure that we're getting people the program services and products that they need. And there's also many additional frameworks that can add value as part of all of this. So they can be sector specific. They can be things like I know Justin and his group use quite a bit, like the COM-B when you're thinking through behavioral and implementation science frameworks, and equity analyses, which are coming up a lot and are very important. And I think there's a lot of frameworks that you can leverage there. The important thing is that having a framework or an approach can be super helpful. So here's an example of how, depending on the framework you use, different forms of evidence might be useful. So if you're taking the policy analysis framework I spoke to in the last slide, noting here the similarities with the learning and improvement cycles, very similar. Trying to understand a problem and its causes might leverage things like data analytics or modeling, but when you're thinking about selecting options, you could be drawing on different forms of evidence as well, like guidance and technology assessments. Of course, evidence syntheses can weigh in here as well across all these stages. The important thing is that the framework is a super helpful way of structuring your approach to identifying what evidence you actually need, if it is research that you do need, because as you can see, depending on where you are and the questions you're trying to answer, it can vary depending on that component. So this is, I think, the key thing that I hoped folks could walk away with, trying to make your life easier. So there are important repositories of existing evidence syntheses that are already quality rated for you, that you can draw on today if you wanted to get insights from best evidence about the problems that you're dealing with or you're thinking through in your OHT, what solutions you might be co-designing with your patient, family caregiver partners, etc. So if your question is more on the clinical program services and products, so which types of treatments or programs do we need to put in place now? Access is a key database that you can consider. And I provide the links at the end of this as well. And I'm sure that we'll circulate the slides to the participants today, so you'll get these. If your question is more about public health programs and services, then health evidence would be your place to go. If you're looking at health system governance, financial delivery arrangements, and implementation strategies, health systems evidence is where you might go. And similarly for social system arrangements, plus program and service areas outside of health, so in non-health sectors, then social systems evidence might be a place that you consider going. So all of these have quality appraised evidence syntheses for you to draw on. Oftentimes, they have already organized the studies by things that might correspond to any MISI framework or mutually exclusive collectively exhaustive framework that you've adopted. So it could be that you're looking for particular types of evidence syntheses. It could be that you're looking for particular approaches to program design, different system arrangements, like how to pay primary care physicians differently. You might be looking at different populations. The good thing about these repositories is that you can go in through any of these windows and rapidly find evidence and identify whether it's high quality, low quality, because it's been pre-appraised for you. You might also be able to look for a filter for living evidence syntheses already that you can pull on and get updates about occasionally. There are other forms of domestic evidence that you can kind of look into, as I've already said on the other slides. These repositories are quite easy to use in and of themselves, but they're often designed more for researchers who are doing their own evidence synthesis. So they're helpful. You might go in and search. Increasingly, like places like PubMed are getting better for helping you do quick searches. But these are the types of places you might look for domestic studies and in particular evaluations in your topic area that were conducted in Ontario. Once you've got the evidence in place, and as I've said on the last slide, the places I'm pointing you to are already quality appraised. But you really want to look at a piece of evidence that you've identified and saying, is this of broad relevance to the scope of my area of interest? So is this something that's aligning with the framework that I've developed? Am I looking at a problem and is this helping me answer my question about a problem, or am I looking for a particular population? So it seems easy, but I think looking through these steps can help you structure your thinking and hopefully reduce the chaos that might ensue if you didn't have something like this otherwise. So the second step here is confirming the specific relevance to the question being asked. So, as I've showed on the other slide, there are different types of studies and systematic reviews that you might, or evidence syntheses that you might draw on, depending on where you are in your learning and improvement cycle. So you can ask that question too. So is this relevant, answering the part of the question that I'm interested in? Number 3 here, really important, identifying what the best evidence is for your question. So ideally, you'll have an ability to do a quality appraisal if it's not done already. The places I pointed you towards already have that done for you. That's part of the plan today. So using things like an AmStar rating, and ideally, you're not assessing quality based on poor proxies. So credibility of an author or credibility of the organization that produced the work is not a good proxy for high quality research evidence. Whether something has been peer reviewed, as I've said before, is not a good proxy for high quality research evidence. Certainly, there are lots of published peer reviewed evidence syntheses out there that aren't done to a high standard. Availability of a grade profile is going to be helpful for those particularly interested in whether or not something works. So something like a grade profile, you may have heard of this before, can tell you how much certainty you can place in the findings of a particular evidence synthesis you identified. Ideally, something has been done within the last 5 years. That's what our cutoff date is when we're considering currency and recency. And you might look to things like the countries studied and included, and it should say synthesis there, because that can help you understand whether or not the findings from that particular synthesis are relevant to your own settings. So if you're able to get to this stage and you are kind of thinking through, well, how do I organize this in a way that's going to help my team understand it? We often think through things like organizing all of the studies we find based on our framework. So it could be you have a particular section for population A, and here's all the studies we found. We also find that it could be helpful for readers to navigate this by providing a statement of what was found in the evidence synthesis and providing a link to any publicly available versions of that document. And then moving on, I think this is also key. So I'm not going to spend too much time on this, but I think it's important to realize that when we think about high-performing evidence support units like the ones that we've been exposed to earlier on in this call, it's important to work with them to clarify the form of evidence you're looking for. As I've already said a number of times, there's many different forms of evidence, and you might need one and not the other. It could be that your question requires you need all forms of domestic and global evidence, but I think it's helpful to engage folks like Justin, Diana, and John with a little bit of an understanding and working with them to try and clarify whether it's data analytics you might need, modeling, evaluation, behavioral implementation, research, qualitative insights. It could be that you're just looking for an evidence synthesis of the best available global evidence, and it could be that you're looking for recommendations on how to proceed with a particular course of action. So all of these could be in the remit of a group like Justin's, Diana, or John's, but it's important to work with them to clarify what that is. And I think the slide I showed earlier where I was mapping different forms of evidence to the learning improvement cycle can be a helpful starting point for you in your OHT. I think it's also important to decide whether or not you're wanting to engage in a specific trade. So different groups have different, I would say, areas of expertise. So our group at RISE would be, for those of you who have been exposed to the McMaster Health Forum side, consider ourselves, more of a specific trade that can do things like rapid evidence syntheses for your questions, but there might be others that you engage that can help you navigate all of their partners. So if you need a data analytics study, they can point you to the right data analytics folks, et cetera, et cetera. So I'm not going to speak for others on this call, but there might be ways to consider them general contractors to make connections with different points of expertise across the province there. I think it's important to look at different websites to see what self-serve options are available. Justin mentioned that they post all of their things publicly and the outputs of their research publicly on their website. So that's an example. I'm sure John and Diana do the same for Craner. And it might also be helpful to look at the website of groups who are providing evidence support to determine the types of products and processes that they can help you with. So for example, rapid syntheses or living products, or maybe it's something like a rapid qualitative assessment of views and experiences from a particular population. So here's just a quick example of the McMaster Health Forum /RISE. So here's how we provide people access to our own products. And I've already mentioned these repositories that we manage. Part of what we do at the McMaster Health Forum and use to underpin the work that we do at RISE is manage 3 databases. So one on health systems, one on social systems, one on COVID-19. These are all examples of self-serve. So what we mean by that is you'd go to these websites and be able to reach into the research world and pull it out just in time for when you need it. We also provide evidence support in the same way that Justin, Diana, and John have already mentioned. So here's just it's a half screen. I didn't have a chance to pull everything in. The scrolling wasn't working properly, but we can provide people with rapid evidence syntheses as well. So whether it's a rapid evidence profile or a full synthesis, or living versions of those two things, we can do these in rapid timeframes for folks when they have questions that relate to kind of programs and systems type questions. Going back to thinking through that Ontario has a range of folks available to provide you with evidence support. Many of them we've spoken about today, we've heard from, and others you'll see there like Inspire, Rise NOSM for those working in the north, HSPN, of course, I would say RABE as well at the Ministry of Health, and I see Jeffrey on the line today. All of these are types of groups around the province who can provide you with evidence support in a timely, demand-driven way, and they're linked to support decision-making up to advisory and decision-making processes as well as out to learning and improvement platforms. So this is our best take at trying to organize all of the groups across the province that can provide this type of support by type of evidence that I mentioned. But note that as we've seen in the presentations today, there are many areas of overlap here. So it's not as though just because we're written into one area, it means that that's all we can do. And relating back to step 3, which I saw someone in the chat box helpfully say, this is the slide. Well, here are the links to the 4, I think, key databases that if you and your OHT are working on trying to pull in best evidence from evidence syntheses, here is where you would go for the different types of questions. So again, access for clinical programs and services, health evidence for public health programs and services, health systems evidence for health systems questions, and social systems evidence for things outside of health. And these are all free public resources for you to use. I don't think it's that weird. You know, McMaster is known for evidence stuff. So all of these databases are run by different groups. We're not always working together, but we coordinate when we can on these. But these are all based out of McMaster because we think having access to free, quality appraised evidence syntheses is a great way to help you increase the likelihood that you'll use best available evidence and evidence syntheses when you can.